The healthcare industry in America leaves so much to be desired. Medical debt is increasing, billions are lost in unpaid claims, hospitals are in the red, service prices can range up to 30x. But that's not all.
Nobody knows the price of healthcare. When we say nobody, we mean nobody.
It's unaffordable, opaque, and it's becoming a leading category for viral memes as a result.
Around 50% of every dollar that is being invoiced is being uncollected. That's unheard of.
Healthcare, broadly known and understood to be among the worst consumer purchasing experiences.
We have definitely talked to some clinics where if they don't get paid 1 month, they literally can't make payroll.
What is actually being unwound is the backbone of healthcare for a very large portion of the country. And so I think it's going to just blindside and surprise a ton of people.
As part of this short 6-video series on the emerging intersection between healthcare and fintech, we talked to the founders trying to modernize the $4 trillion healthcare industry, together with the help of fintech. As a reminder, the content here is for informational purposes only, should not be taken as legal, business, tax, or investment advice, or be used to evaluate any investment or security, and is not directed at any investors or potential investors in any A16Z fund. For more details, please see a16z.com/disclosures. Let's start by talking about one of the biggest problems in healthcare: the lack of transparency around price. Now, everyone seems to have a story about some crazy medical bill. But here's the surprising thing. Nobody knows the price of healthcare. Sometimes not even the providers. Since 2021, federal law has required hospitals to publicly post information about their standard rates and negotiated discount rates for common health services. The aim? To encourage consumers to compare prices and also to promote competition. But fast forward to 2023, and deciphering healthcare costs is still a complex process. Here is Chris Severn, co-founder and CEO of Turquoise, a company building software to give people the cost of healthcare in advance.
Yeah, in our corner of the world, what we care about is nobody knows the price of healthcare. When we say nobody, we mean nobody. Patients don't know the price. Providers often don't even know the price for their own services. Payers, employers, and the list goes on and on.
In fact, Chris started building Turquoise because of his experience as a healthcare consultant, getting to see just how broken the system was.
In my former life, I was a healthcare consultant, and I lived for 5 years in these payer-provider reimbursement contracts. I became an expert in them and all their nuances and complexity. What I didn't realize at the time is that those were secret. It was me, the consultant, the provider, and the payer that had access to those contracts. And so when you think about innovation and maybe why there aren't more startups doing this, it's because there was this information asymmetry granted to those of us that worked with these contracts before January 1st of 2021. And so that consulting experience is 100% why we were able to hit the ground running.
Although that paints a dire picture, things are changing. New laws have been passed in the last few years, like the Price Transparency Act or the No Surprises Act, which make pricing more transparent.
This is very similar to a lot of other new technology life cycles, where this isn't new technology, but it is a sudden event in US healthcare that we have access to these prices and the data is really big. And as any new technology matures and as this healthcare pricing data matures, the barriers go down to access it. It becomes cheaper, more widely available, more user-friendly. We're seeing that happen day over day at Turquoise.
But it's not quite smooth sailing yet. Though these new laws require providers to share prices, those costs are specific to each patient, geography, coding system, and insurance product.
These new laws mandated every provider, every payer in the United States to disclose the price of healthcare. And these prices are complex because it's not just like when you go to a restaurant where everybody sees a menu. First of all, we don't know what's on the menu. And second, depending on what insurance you have, you pay something different. So you can imagine that if we all went to dinner together, but we all paid a bit different price, it gets really complex.
Healthcare pricing is still so complex that even Turquoise can only give an estimate, although Chris hopes that changes. And that is just on the consumer side. The B2B side brings its own set of complications.
On the B2B side, there's a whole litany of issues that make it slightly more complex than just saying, hey, here's a big database, go browse around the price of healthcare. Some of the nuances that I'll just point out is that geographically, some healthcare prices are agreed by one medical billing and coding system, and then you cross state borders and they use a different medical billing and coding system. So it's really apples to oranges when you make those comparisons. Some prices are really a formula. And so you're comparing like, Y equals MX plus B, like some complex formula, to another provider that might just have a straightforward named fee schedule price.
It turns out that high school calculus still does come in handy. And given these fundamental shifts, here is how Chris envisions the future of medical billing. A world where you can look up the exact price for care up front, prepay for it, and then never see a bill again.
It'll get to the point where, as a patient, you'll be spoiled by the providers who spoil you, right? And you'll come to expect that level of financial experience everywhere you go. You'll be at dinner, at a bar, and people do actually talk about this stuff. I've learned at dinners and at bars. It's like, wow, you got this crazy medical bill. And someone at dinner will be like, why? Why'd you get a bill? Like, are you still using a provider or an insurance company that sends you a bill? It'll be similar to if someone were to bring up like non-electronic medical records, like your office has like folders of paper. Why? And I think that's where we'll be at in about 3 years.
So what do you think? Can we rebuild this broken system? Where do you see the biggest opportunities for disruption in healthcare? Let us know in the comments below. And if you like this video, be sure to check out our next installment with Cedar, a company on a mission to simplify the medical billing process, where 50% of every dollar being invoiced is not even being collected. And if you'd like to learn more about how fintech is revolutionizing healthcare, head on over to a16z.com/healthcare-meets-fintech, or click on the link in our pinned comment. Thanks for listening to the A16Z podcast. If you like this episode, don't forget to subscribe here on YouTube to get our exclusive video content. We'll see you next time.